Hi friends, good morning all of you. Welcome to my channel. So today we are going to discuss about the third ventricle. Before going to explore this, please subscribe to my channel. So as we are doing these short video classes, so in the previous class we have seen the lateral ventricles and today we are going to see the third ventricle. So the third ventricle, which is like a narrow slit-like cavity which is present in the midline. So the right and left lateral ventricles we have seen in the cerebral hemispheres respectively. So the lateral ventricles opens into the third ventricle through a foramen called as interventricular foramen of Monro. So on either side of the third ventricle, we can identify the thalamus and hypothalamus. So it's just like a small slit-like cavity. It is lined by ependymal cells. So here it is having anterior wall, posterior wall, roof, and the floor. So let us see what are the structures forming the anterior wall. So anterior wall has been formed by the anterior column of fornix, anterior columns of the fornix. Then you can identify anterior commissure. Then you can identify the lamina terminalis. The posterior wall has been formed by posterior wall form is formed by pineal gland, then posterior commissure, and also the commencement of cerebral aqueduct of Sylvius. And coming to the roof of the third ventricle, roof is formed by ependyma that stretches across the upper limit of the two thalami, upper limits of two thalami. Exactly speaking, the ependyma is reflected from one thalamus to the other at the site of stria medullaris thalami. And also the floor, which has been formed by from anterior to posterior, we can identify optic chiasma, tubercinerum, where it is also tubercinerum and the infundibulum, that is stalk of the pituitary gland, then mammillary bodies, and posterior perforated substance, and also the tegmentum part of the midbrain. So these are the structures forming the floor of the third ventricle. So that is about the roof, floor, anterior wall, and the posterior wall. And it's having the lateral wall. On lateral wall, we can identify a sulcus called as hypothalamic sulcus. So this hypothalamic sulcus, which is separating the thalamus into two parts, upper large area, lower small area. So in the upper large area, we can identify the thalamus, and below the sulcus, we can identify the hypothalamus, the smaller lower part, which is consisting of the hypothalamus. On this lateral wall, which is consisting of the interthalamic adhesion, where the right and left thalamus, which are connected with each other, that is called as interthalamic adhesion, which is present at the lateral wall of this third ventricle. So that is about the roof, floor, anterior wall, posterior wall, and lateral wall. Then coming to this lateral wall, we can identify most anteriorly, we can identify a foramen called as interventricular foramen of Monro, where the lateral ventricle opens into the third ventricle. And now we are going to see the races of the ventricle. Races of the ventricle, we can identify different races. One is infundibular races. Infundibular races, it is a deep tunnel-shaped races extending downward through the tubercinerum into the infundibulum. And then optic recess or optic chiasmatic recess, it is an angular recess which is present anterior to this infundibular recess, and where we can identify the optic chiasma, which is present between the lamina terminalis and then the infundibular recess. The next recess is anterior recess, or it is also called as vulva of ventricle. So it is a triangular recess which extends anteriorly in front of interventricular foramen of Monro. So this is anterior recess or vulva recess or vulva of ventricle. So it is exactly present between the anterior commissure and the anterior column of the fornix. So there's about three recesses we can identify. One is vulva of ventricle, then optic chiasmatic recess, and then the infundibular recess. Yes, posteriorly we can identify two recesses. One is suprapineal recess and the pineal recess. So the suprapineal recess is a more capacious and which is extending posteriorly, and it is present above the pineal gland. Then the pineal recess, which is a small diverticulum, which is projecting posteriorly, extends between the superior and the inferior laminae of the stalk of the pineal gland. So there are two recesses, you remember, posteriorly suprapineal recess and the pineal recess. That is about the recess of the third ventricle. Then moving to the next topic, that is a choroid plexus. Yes, coming to the choroid plexus and the tela choroidea of the third ventricle, the tela choroidea in the roof of the third ventricle is triangular in shape. Triangular in shape. The choroid plexus of the third ventricle hangs downwards from the tila choroidea as a two longitudinal anteroposterior vascular fringes. The blood vessels contributing to its formation and derived from the anterior choroidal arteries. So that is the short video on this third ventricle. In the next class, we are going to discuss about the fourth ventricle, roof floor, and then the two lateral walls. All the other structures we are going to see in the next class. Till that, see you